Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be covering UTIs. I'm doing another Kahoot where I'm going to be going over the clinical manifestations, the risk factors, nursing intervention, treatments, all of that. Now, before we get started, as always, guys, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. So press that thumbs up button now so you don't forget. Subscribe to my channel if you haven't done so already. Press that red notification button so you'll be notified every single time a new video is released or when I'm going live. Also, guys, don't forget, I'm now offering NCLEX reviews. You can book through my website. Just go check it out, nexusnursinginstitute.com. Also, you can get audio lessons on my website as well, nexusnursinginstitute.com. All right, guys, without further ado, let's get started. What is the most common bacterial infection in women? Is it urinary tract infection, pyelonephritis, chlamydia, or herpes? What do you guys think? Okay, urinary tract infections. Obviously, this is the title of the Kahoot we're doing, but it's urinary tract infections, and I'm going to explain to you why in a little bit. But let's go over the wrong answer choices. So guys, the urinary tract infection, that is a lower urinary tract infection. Pyelonephritis, this is an upper urinary tract infection. Chlamydia, this is a bacterial sexually transmitted infection. And herpes, that is a viral sexually transmitted infection. So when we're talking about bacterial infections, they're common in women. The most common is the urinary tract infection, which again is a lower urinary tract infection. Select all that applies. What are the clinical manifestations of a urinary tract infection? Select all that apply. Here are your choices. Dysuria, hematuria, hesitancy, urinary retention, urinary frequency, urinary urgency. And remember, guys, as always, when I teach about select all that applies, I expect you to answer them as if it were true or false. And that's how you increase your chances of getting the answer correctly. Go through each answer choice and go back to the question. If it's true for your question, pick it. And if it's false, throw it out. Don't try to group them together to make it true. That's how you guys get in trouble. Okay, all of them. All of those are signs and symptoms of a urinary tract infection. So what are those signs and symptoms? Dysuria, it's going to hurt when that patient urinates. They've got infection. Usually they got cystitis. They've got spasm and irritation of the bladder because that's where the pathogens are. It's going to hurt for them to urinate. Hematuria, if you do a urine collection on them and you test the urine, you'll see RBCs. Are you ever supposed to see blood in the urine? Absolutely not. Hesitancy. It is painful. They are going to be very hesitant to urinate, even though they're going to feel like they have to urinate because it hurts. Urinary retention. Absolutely. They will urinate and then 2 seconds later, they feel like they have a full bladder. Why? They didn't completely empty their bladder the first time. They're going to have urinary retention. Urinary frequency. Yep. Guess why they have that urinary frequency? Because of the urinary retention. They did not fully empty the bladder. Remember, it is very painful for them to even urinate. And of course, urinary urgency. They're going to feel like they have to go immediately or they're going to urinate on themselves. All of these are signs and symptoms of urinary tract infections. True or false? Males are at higher risk for UTIs than females. What do you guys think? True or false? There are more than 50 people in the room. Come on, guys. Very good. False. Females are at higher risk for urinary tract infections, and it has a lot to do just with the anatomy of the female urinary tract organs, they're a lot shorter. So guess what? There's a smaller distance that the pathogens have to travel to get to the bladder. So women are at higher risk for UTIs than men, much higher. True or false? Sexually transmitted infections are the most common healthcare associated infections. True or false? Very good. Most of you guys chose false. So in this question, the key was this: health care associated infections. How are you going to get STI from a healthcare professional? Are you sleeping with that healthcare professional? No. So healthcare associated infections are infections that you get in the healthcare setting. So for example, and I say this all the time, anytime something's being introduced to your body, it increases your risk of infection. So if you have a condition where catheter has to be placed, right? That increases your risk for infection because that's something foreign that is being introduced to your body. So increases the risk of those pathogens being introduced to your body. What is the most common pathogen that causes a urinary tract infection? Is it Proteus? Is it Klebsiella? Is it E. coli? Or is it Enterobacter species? What do you guys think? It's E. coli. It's E. coli. And where's E. coli found? In the stool, in feces, right? So what happens is very often, maybe the person didn't wipe well, and so they had some feces that got on their underwear. And as you're walking, it may rub against the vagina and it goes right up through the urethra to the bladder, right? Or maybe the patient was wiping from back to front, and so they pushed a stool that was, on the back side up to the front side. So anyway, the most common pathogen that causes UTI is E. coli, which is found in the stool. That is very important for you guys to know. Select all that applies. What are the known risk factors for urinary tract infections? Select all that applies. So here's our choices. Multiple sex partners in women, the use of a diaphragm, taking bubble baths, poor personal hygiene, wiping back to front, wiping front to back. Select all that apply. What do you think are the risk factors for UTI? Come on, guys. I'm waiting for about 15 more answers. Some of you still thinking? Okay, so let's talk about this. Risk factors for UTIs. Having multiple sex partners, and there are a couple things that go into this. Again, anything that is a foreign body that is being inserted into your body is going to increase the risk for infection. That's one. Two, I was going somewhere with this. There was something else I was going to tell you. After sexual intercourse, not urinating immediately after, because what happens is when you have sexual intercourse, those pathogens that were introduced, right? If you urinate immediately after, a lot of the times you can flush out those pathogens, just flush them right out of the bladder, right? So yes, multiple sex partners, use of a diaphragm. Again, any foreign body being inserted into the body. So yes, that's going to increase the risk. Bubble baths. I want you to think about this. Think about all the germs and pathogens just sitting in the tub, right? because you have to step in the tub with your dirty feet to take a bath. So now you're sitting in that the tub, and those pathogens, those germs that were just sitting in the tub are now floating in that water. Guess what else is in that water? Your vagina. Okay, so that definitely increases the risk of UTIs. And besides that, with bubble baths, you have soap. And as you know, soap for the vaginal area, it gets rid of the normal flora, the good bacteria that keeps, things from yeast and other stuff like that from growing. So it gets rid of that. So that absolutely increases your risk for UTIs. Poor personal hygiene. The example I gave you about not wiping well after you have a bowel movement, and then you go on about your day, but now you've got some stool on your underwear. Now that underwear is rubbing up against your vagina, and before you know it, the bacteria has now crept from up the vagina and gone up to the bladder via your urethra. Wiping from back to front. Obviously, that can give you a UTI because of E. coli that's in the stool. You're bringing it up to the front, but not wiping front to back. No, you're supposed to wipe front to back. Wiping front to back will decrease your risk for urinary tract infection. So everything except wiping front to back. Wiping front to back is a good thing. Select all that applies. Which group of people are at the highest risk for urinary tract infections? Select all that apply. Here are your choices, guys. Debilitated persons, older adults, immunocompromised persons, diabetics, athletes, persons on immunosuppressive drugs or steroids. This is select all that applies. I increased the time frame for the select all that applies from 30 seconds to 1 minute because I noticed with the select all that applies, less than half of you ever answer, and I figure it's a time frame issue, so I want to give you guys more time. And it worked because way more of you guys are answering select all that applies now than before. Okay, guys, so let's talk about this. The groups that are highest risk for UTIs. Let's start with the debilitated persons. That makes sense because one of the ways you can have a UTI, if you're not emptying your bladder often, and here's the reason for that. Remember how I told you one of the ways to decrease your risk for UTI is to actually flush out your bladder, to urinate often. Why? Because the bacteria won't have a chance to sit there and stick against the lining of the bladder because you're urinating. It's going to come out with the urine. So the person who's debilitated, they're really not able to move around. They can't get to the bathroom. So they're not flushing out the bladder the way they're supposed to. So they are at high risk. Older adults, same thing. They're not moving around like they're supposed to, so they may not be flushing their bladder out as often. That's number one. And number two, remember, as you get older, just physically, the anatomy changes, right? So it may take longer for that urine to leave the bladder. Immunocompromised persons. Well, it says it right here in immunocompromised. Anybody that's immunocompromised is at risk for infection, period. Doesn't matter what type of infection. If they're immunocompromised, they're at risk for infection. When I say immunocompromised, who falls under immunocompromised status? Anyone with HIV, anyone with AIDS, cancer patients who are on chemo, who are on radiation, patients who are been on steroids for a long time. Oh, I just gave you the answer. Yeah, patients who have been on steroids for a long time, patients with autoimmune disorders such as lupus, right? If you're immunocompromised, you're going to be at risk for all types of infections, including UTIs. Diabetics. Well, Professor D, why diabetics? I'm so glad you asked. Let me answer this. So think about it. Diabetics, their blood is full of sugar, right? Guess what bacteria loves? They love dark, wet sugar environments. So they grow, they flourish in that type of environment. So the patient with diabetes, they're going to be at risk for infection. They're going to have slow wound healing because of all that sugar that's carried in the blood. That's why. Okay. Athletes, no, they're not at high risk for infection, but persons on immunosuppressive drugs, steroids, Absolutely. They're at risk for infection, and I already explained to you guys why. Here is another select all that applies. What are UTI preventative activities? Select all that applies. So what can you do to prevent UTIs? Empty the bladder regularly and fully, wiping from front to back, avoiding vaginal douches or harsh soaps, drinking plenty of fluids, taking a higher intake of caffeine, alcohol, citrus juices, chocolate, and spicy foods. Or, you know, Professor D, I have no clue at this point. I give up. What do you guys say? Preventative activities to decrease the risk of UTI. How are you guys doing on the live? Okay, I see you. Keep answering. If you weren't able to get on the Kahoot, that's fine. Just type it in. Okay. Only about 36 people answered, but guys, I gave you most of the answers when I was teaching. Emptying the bladder regularly and fully. Yeah, you're going to flush out those pathogens. Wiping from front to back. Exactly. You're not going to introduce that bacteria, E. coli, to your vaginal area. Avoiding vaginal douches and harsh soaps. Absolutely, because we love our normal flora. We're not trying to get rid of our normal flora. Drinking plenty of fluids. That also helps because it helps to do what? Flush out the bladder. Higher intake of caffeine, alcohol, citrus juices, chocolate, and spicy foods. This one is, and the reason for that, guys, I should not have, I don't know why I put the spicy foods in there, but I want to talk to you about it. It should actually have been, and the alcohol. Let me explain this to you. This shouldn't have been in there because I want to explain to you. There are a couple things in here you guys absolutely have to know. So, caffeine. Caffeine is a bladder irritant. I don't know if you guys knew that. It's a bladder irritant. It can act as a diuretic, makes you urinate, but it is a bladder irritant. Alcohol. We never encourage alcohol for anything. Citrus juices. Here's what with the citrus juices. Pathogens don't like an acidic environment, and so that's why patients are encouraged to like drink cranberry juice, because what happens is that cranberry juice, we're not 100% sure, but what studies have shown, what we're thinking happens, the mechanism that it helps people with UTIs, it keeps the pathogens from sticking against the inner lining of the bladder. If it's not sticking against the inner lining of the bladder, when you urinate, it can be flushed out more easily. The chocolate and spicy foods, to be honest, I just don't recall about these two. I got to go look this up and I'll get back to you on it. I just can't tell you right now. And let's see. Oh, good. Nobody chose purple. Very good. Somebody please remind me in the comments about the chocolate and spicy foods, because I got to get back to you about it. But I want to say absolutely not, but I don't remember. I don't remember why. I don't remember the rationale for that. And you know, I'm very big on rationales. You guys can't memorize in nursing. You have to know why so you'll never forget. Like I just forgot. So someone in the comment section just remind me and I'll get back to you on that. True or false? Daily intake of cranberry juice or cranberry tablets or capsules may reduce the number of UTIs. Is this true or is it false? And I already gave you guys the answer. So what do you say? Very good. Who is the 5 people that chose false? After I just told you about cranberry juice, I just told you how it keeps the most likely it keeps the pathogens from sticking against the inner lining of the bladder, so you can just flush it out when you urinate. I just gave you guys an answer. It is true. True, true, true. True or false? To decrease the risk of a urinary tract infection, the patient should be taught to wipe from back to front. Is this true or is this false? You guys shouldn't even think twice about this by now. False. The 4 that chose through true, at this point, I think you guys are messing with me. False. We don't want to wipe from back to front. We want to wipe from front to back to decrease the risk of getting a UTI. True or false? A clean catch urine specimen does not need to be refrigerated. Is that true or is that false? A clean catch urine specimen. Does it need to be refrigerated or not? False. That is false because it absolutely does need to be refrigerated. We need it refrigerated to keep the contents of the urine from breaking down. Okay. Let's talk about the clean catch. So with the clean catch, you have the urine start a stream. So they're going to urinate first. You're not going to catch that, the first urine, but then mid-urine, you're going to go ahead and catch that. And the reason for that, when the patient first urinates, you might be getting the urine that was sitting right there in the, right there at the tip of the bladder, urethra ready to go. We don't want that because it may be contaminated, right? We want the urine that was sitting inside of the bladder. So that's why it's called clean catch. We let them urinate, we let them start that stream first, and then we catch the urine to make sure that we get the urine that's inside of the bladder. The urine should be cultured within how long of refrigeration? Okay, so we've established that the urine has to be refrigerated. Is that word refrigerated? Yes, refrigerated. So we've established that. So how long after refrigerated does it have to be cultured? 24 hours? Excuse me, 2 hours, 12 hours, 24 hours, or 48 hours? What do you guys say? Within how long do you have to get it cultured? Very good, within 24 hours. And I was thinking about the answer. That's why I said it. So yes, it has to be cultured within 24 hours. And remember that culture will tell us what's actually in the urine. What are we seeing? What is growing, right? The culture tells us what's growing. The sensitivity is what tells us, what leads us to which antibiotic that patient should get. That's what lets us know what the patient is going to be resistant to, or they'll actually be sensitive to, which means it's a good option for that patient to get that medication. Select all that applies. What is a drug of choice for uncomplicated urinary tract infections? This is a select all that applies. So what do you think would be the drug of choice? Bactrim, macrodantin, Monurol, mannitol, dilantin, dexamethasone. What do you guys think? Wow, only 19 people answered. So let's talk about this. Great drug choices. Bactrim, antibiotic. Microdantin, antibiotic. Monurol, antibiotic. Not mannitol. What is mannitol? Mannitol is an osmotic diuretic. That would be something good for a patient that has increased intracranial pressure and we need to get that fluid down, right? Dilantin, that's not an antibiotic. That's an anti-epileptic drug. That's for a patient who has seizures, right? Corticosteroids, dexamethasone, that's not an antibiotic. That's a steroid, right? That helps to decrease inflammation. We would give this in a variety of conditions where we want to actually decrease inflammation. But when we're talking about UTIs, most likely those UTIs are going to be bacterial infections and we want to give antibiotics. So the first 3. Those are usually our first go-to. True or false? I can't pronounce that med, is a potent antibiotic that treats UTIs. Phenazipridine. Guys, you know I can't pronounce. You know I can't pronounce, but that med right there, if I see it, I know it. It's a potent antibiotic that treats UTIs. Is this true or is this false? And if you guys are taking a G right now, you absolutely need to know this. Pay attention. I'm so proud of you guys. Most of you chose false. That's right. It is not an antibiotic. This medication is an analgesic. Now, it's given to patients who have UTIs because remember, one of those signs and symptoms of UTI is dysuria. It is very, very painful. So it helps relieve that pain with the urinary tract infection, but it's not an antibiotic. It is an analgesic. And something very important, you're going to warn the patient that it most likely is going to turn the urine orange. You have to warn that patient in advance or they will freak out. Okay, so you're going to let the patient a bright, very bright orange color that it can turn the urine. Correct. Analgesic, not antibiotic. True or false? Urinating before and after intercourse is helpful in flushing out the bladder and decreasing the risk for urinary tract infections. Is that true or is that false? Come on, there are more than 36 people in the class. Let's go, guys. All right, so very true. Everyone chose that correct. Very, very true. We want to flush out the bladder before and after intercourse. Urinating helps decrease that risk. You guys are great. Last question. What is expected treatment for urinary tract infections? Is it antibiotics, antiviral agents, antifungals, or I need to study this more? I don't know anything about this. What do you say? What's expected treatment for urinary tract infections? Awesome. Antibiotics, because usually the UTIs are of a bacterial nature. All right, guys, thank you so much for watching this video. Please, if you haven't done so already, don't forget to give it a thumbs up. Subscribe to my channel if you haven't done so already. Almost daily, you can find me covering a variety of nursing topics on my other social media platforms, such as TikTok, Instagram, Facebook. Be sure to check me out there. And don't forget, I'm offering NCLEX reviews and audio lessons you can book from my website, nexusnursinginstitute.com. Thank you for watching. You guys catch me on the next video.